This is a lecture about antiviral medications, and there's several classes of antiviral medications. We're going to start out though with the nucleoside/nucleotide reverse transcriptase inhibitors. So the first one we're talking about here is Zidovudine. Okay, some of these first pictures are pretty lame, but later on I cut some pictures off Google search. It gets a little better. So Zidovudine is something that has a bioavailability of about 80%. Its half-life in serum is about an hour, and if it gets into the cell, its half-life is about 6 hours. It has a cerebral spinal fluid percentage of 66%, and its adverse effects is that it is myelosuppressive, particularly neutropenia and others. Myelosuppressive means it goes into bone marrow and it suppresses those cells in the bone marrow. And interactions, too numerous to count, not well organized, just tons of them. And other information is this is actually okay in pregnancy. So how did I work on memorizing this? Well, this is the only one I can see that started with a Z, so I just put a Z made out of bones to remember that it's myelosuppressive. So when you think Zidovudine, it starts with a Z. And as far as its interactions, I repeated lots and lots of Z's here to show that they're too numerous to count. Its interactions are too numerous to count. And there's also a pregnant woman here sleeping because she's doing just fine, because this drug Zidovudine is just fine in pregnancy. I also did a little plate here because it looks like most of the nucleotide ended dine, so I thought maybe Zidovudine, a little dining on a plate, yeah. Okay, next one. Next one here is diadenosine. So diadenosine is another one of the nucleotide reverse transcriptase inhibitors, sometimes they just call these NRTIs. And diadenosine has a bioavailability of 33%. Its half-life is 2 hours in the serum and 10 hours intracellularly. It has a CSF percentage serum of 20%, and its adverse effects include pancreatitis, neuropathy, gout, and retinal changes. So this is a little weird. This is a goat named Dan over here. Oh, by the way, I probably should finish. His interactions are many, including quinolones, which decrease its bioavailability, and it has little resistance effects. So okay, all right, here is the goat named Dan the goat. So Dan diadenosine, Dan the goat. Okay, so I have he's a goat because this can cause gout. So Dan the goat, or gout. Okay. I have little F's on his heels with down arrows because because quinolones decrease its bioavailability, and also because it has low bioavailability compared to the other ones. This is only 33% bioavailability, whereas the other one's like 80 or higher. So low F for bioavailability. And this is a pancreas, because of pancreatitis. So this Dan the goat, diadenosine, wants to eat the pancreas. And it looks like it's on fire because it's pancreatitis. Here are the little Q flies. Q stands for quinolones. These get a little better later. I apologize. The early ones I was having some hard times with being creative. And here is his eye. Has a little change symbol on it. So this is retinal changes. And it looks like I didn't even include neuropathy on there. Maybe he looks like he's neuronic or something. I don't know. All right, next one here, Stavudine. So Stavudine, for this one, I have a dagger that's stabbing. Kind of sounds like stab. I should have used a staff, but whatever. Anyway, Stavudine, dagger stabbing a dinner plate for dine, Stavudine. And this one, side effects. Or I guess I should go over real quickly. Its bioavailability is, higher again, 80% bioavailability, half-life, 1 hour in serum. 4 hours intracellularly. So this has the lowest half-life of all of them. And CSF percentage is 55%. So what does this cause? Peripheral neuropathy. That's what this wavy neuron arm here is peripheral neuropathy. And lactic acidosis. I put milk here. That's another cause. And didn't include the NASH on there, sorry. But here it interacts with didanosine. So I drew over here. This is seen as interacting with Dan, the goat, again. Okay, next we have, Lamivudine. That is apparently a llama. I apologize. That's a terrible driving a llama. But 80% bioavailability, 3 hours in serum, 14 hours intracellularly, 20% CSF. Milder constitutional symptoms than congeners. So I put this as the mild llama. This one has a pretty long half-life. Not as long as Abacavir, or Teenavir, some other ones. But anyway, yeah, this one's kind of lame. Not a whole lot of interesting stuff on this one. I'm just kind of well, I guess the one thing is the TMP SMX. So I said his tempo sucks. He's wearing a pair of headphones, but his tempo sucks, and he's mild. He's a mild llama. Whatever. That one's kind of lame. Okay. Next one, Abacavir. Abacavir. So I thought Abacavir. So ABA is a very sensitive. You can't really see this very well. Very sensitive. Whoa, that was not supposed to happen. Sensitive band. So if I can get to them, they're all crying. They have tears because they're sensitive, and this has hypersensitivity reactions. Also, its interaction is with ethanol, which, gosh, I'm sorry, it's jumping everywhere. Ethanol, which is here because people in bands drink a lot, right? So here they are, they're ethanol and their hypersensitivity reactions. So Abacavir, Abacavir, and Kleenex. Next, Tenofovir. Teen, I kind of remind me of Teenage Mutant Ninja Turtles, so Teenavir. So here they are over here. The Teenage Mutant Ninja Turtles are for Tenofovir. And 25 to 40% bioavailability, so it's a bit lower than the other ones. And that makes sense because the Teenage Mutant Ninja Turtles always live low under the ground, right? Really, really long half-life. Teenage Mutant Ninja Turtles have been around forever, right? So 17 to 72 hours, 17 hours in serum, 72 hours intracellularly. So this is the longest half-life. Electrolyte disturbances. So I drew these telephone poles here, and they're touching it and getting electrocuted. See, Raphael's touching it, electrocuted. So that represents electrolyte disturbances, even though that's not really how it works, but whatever. And didanosine has interactions again. Here's Dan, the goat, just showing up everywhere. And also, it has a reaction of osteomalacia. And here is the so bone malacia is bad. Here's the bad, evil skeleton coming to fight the Teenage Mutant Ninja Turtles. So that's osteomalacia, so that represents. And Easter, phosphonate, ester. So yeah, they're having a good time at Easter. Okay, whatever. All right, next here we have Mtrick. So I kind of thought that sort of sounded like, when I looked at this, I saw Mtrick, magic trick. Kind of a stretch. You can kind of see the trick in there, right? Magic trick, Mtrick, magic trick. So here's a magic trick, M-hat, magic trick, whatever. 93% bioavailability, half-life in serum, 9 hours, half-life intracellularly, 48 hours. This is, again, pretty long. Has very low CSF penetration. Probably should have put that on here somewhere, but I didn't. One of the side effects of this one's a little odd. Magic trick. People that do magic tricks wear gloves all the time. So imagine this guy wearing this black glove. Okay, it's the dark palms and soles. That's one of the things that has that's associated with taking this drug as an adverse effect, and has almost no interactions. So everybody likes magic tricks. There's no bad interactions there, right? All right, next we have, these are NNRTIs, standing for non-nucleoside reverse transcriptase inhibitors. And I probably should have come up with some way to distinguish these ones from the last ones in the mnemonic, but I didn't, and I'm sorry. First of all, we have nevirapine. So nevi kind of remind me of netty. So netty pine. So here is your netty pine, netty pot, right? So there she is doing her netty pine. And 90% bioavailability, half-life of 28 hours. CSF is 45%. Adverse effects, rash, and hepatotoxicity. So I was trying to think of how to represent hepatotoxicity. I know sometimes if people's get such destroyed liver, or hepatics, whatever, that they can get jaundice. So I drew her eyes yellow on this to show that she's got hepatotoxicity, killed her liver, and now she has jaundice. So that represents hepatotoxicity. The rash, I put some red on her cheek for a rash. Just imagine this picture, the neti pot, neti pine, nevirapine. And interactions, CYP3A4 inducer and substrate. So I drew here with her weird 3 eyebrows. That's a 3, stands for 3A4. So you remember this picture with the weird 3? 3A4. Oh yeah, inducer and substrate. And it's okay in pregnancy. So here's her okay pregnancy test at the bottom. Turns out she's doing an neti pot because she's trying to clean out her system because she's pregnant. I don't know. Fit in the story however you want. All right, next. Delavirdine. Delavir kind of sounds like Delaware. So here's Delaware, okay? And 85% bioavailability. Half-life of 6 hours and low CNS percentage. Rash, hepatotoxicity, teratogenicity, and CYP3A4 and 2D6 substrate. So what did I do with this one? I said, all right, teratogenic represents terrorists. Delavirdine represents Delaware. So we got terrorists in Delaware. And this red all over here, they're giving everybody a rash. And hepatotoxicity, you can't really see this, but they all have yellow eyes, representing their jaundice from hepatotoxicity. And the CYP3A4 and 2D6, I thought of groups of 3 and groups of 2. I don't know. I was kind of stretching on that one. Having a hard time coming up with it. And yeah. Next. Efavirenz. Efavirenz. When I saw F, I thought that actually said ELF at first. So I thought, oh, ELF. And I realized there's no L in there. But you see if Alpha, I think alpha. Okay, here's alpha. And 45% bioavailability. I think he's about 45 years old, right? Somewhere in there. 48%, 48-hour half-life. Maybe he's 48, 45, 48. I don't know. Maybe you can think of that. And low CNS penetration. But there are CNS symptoms. That's why he's got the crazy googly eyes, because he's got central nervous system symptoms. Also a rash. That's why he's got the rash. And dyslipidemia. I was trying to think, okay, lipidemia, lipid, fat. So here's lipid, fat. Just when you think of just this one, remember the fat, think of lipid, Santa Claus going down the chimney. And CYP3A4 inhibitor and inducer. There it is. Well, that doesn't seem to make a lot of sense to me, how something can be both an inhibitor and inducer, but whatever. There it is, 3A4, his eyebrows. And this is the first once daily NNRTI. And I thought, whoa, once a year. This is once a year. Once a year is once daily NNRTI. All right. EtraPurine. Etra kind of sounds like extra, so I thought of this boy. Extra, read all about it. So EtraPurine, EtraPurine. Okay, so don't know what the bioavailability is. Half-life's about 3 to 4 hours. Don't know what the CNS penetration is. But we got a rash on this kid. And we also got hepatotoxicity because of his yellow eyes. And we got peripheral neuropathy. He has this weird wavy arm. And CYP3A4 interactions. So there's his 3 eyebrow. all encoded on the image. Next, Rilpivirine. Well, actually, it's Rilpivirine. And when I saw Rip V, I thought Rip Van Winkle. So here's Rip Van Winkle, and it actually fits in pretty well. We don't know what the bioavailability is. We don't know what the half-life is. Well, excuse me, we do. Half-life is 50 hours. So he looks like he's about 50, right? Maybe not. And the CSF, we don't know. So Rip Van Winkle slept for so long. When he woke up, he was terribly depressed. How sad. And he slept for so long, now he has insomnia. He can't sleep anymore. And he also got a big weird eyebrow, which looks like a 3. That reminds me that there are many, many interactions, including CYP3A4. Oh, he's missing his rash. He's supposed to have a rash. Okay, well, he slept so long, he got sleeping sores and rashes and stuff. Okay, next is Sequanavir. Sequanavir, this is the sequence on this rhinoceros, which I'll explain in a second. Bioavailability, tiny, 4 to 8% bioavailability. That's nothing. So think of this as being a really, really tiny rhinoceros. Half-life, 2 hours in serum, 12 hours in intracellularly. I'm assuming I'm understanding that that's what those two numbers mean. CSF percentage is low. Adverse effects, rhinitis. Oh, rhinoceros. That's what I thought of. So here's the rhinoceros. Rhinoceros wearing a sequin garb and QT prolongation. Cutie. Okay, so this is a cutie rhinoceros. Look, it's got mascara on and lipstick and eyelashes are all pretty. It's a cutie, right? And what does this cutie want to do? It wants to be a pro basketball player. The pro basketball player is a protease inhibitor. This is our first set of these. So distinguish it. Remember, cutie here wants to be a pro basketball player. And interactions, CYP3A4 substrate inhibitor. So here is the 3. She drew her eyebrows on like a 3. Other, less GI distress or dyslipidemia than others. Okay, that's good. There we go. Next, Ritonavir. Ritonavir. There's this kid saying, right on. Yeah. So, 75% bioavailability, 3 to 5 hour half-life, and low CSF, cerebrospinal fluid percentage. Paresthesias and big pill burden. Well, this 2-year-olds can be pills sometimes. So this kid is big pill. And kids also don't move very well, so he has paresthesia. And but when he grows up, he's going to get over it, and he's going to be a pro basketball player. This just reminds you, it's a protease inhibitor. And big weird eyebrow there. That's a 3A4 inhibitor. And he's also a 2D6 inhibitor. So he's 2 years old. So he's not inhibited because he's 2, or he's inhibited because he's 2. And that's all that. Next. Teenavir. Indian. There you go. Indian. So 65% bioavailability. Looks like about 65. He's got the gray hair. 2-hour half-life in serum. 8-hour half-life intracellularly. 76% CSF. Kidney stones. So push oral fluid. So you really need to make these people drink a lot of water so they don't pee out rocks like this guy. See these stones down here? The Indian peed out these stones. That's what those are. Remind you of the kidney stones. CYP3A4 substrate inhibitor. He's got, I tried to draw this weird 3 on his eyebrows, but it was too dark with his hair, so I had to do it in yellow. Apologize. But that's to help you remember that. And also, he is getting a shot because of his insulin resistance, so that he can be healthy enough to play pro basketball. The first Indian to be a pro basketball player. Okay, next. Lamivudine. So when I actually typed Nelf, I was thinking that weird alien guy from the 80s show, but I couldn't remember what his name was. But anyway, I typed this in, and it showed up Netflix. So I got Netflix. Okay, Netflix. I can kind of see it. Netflix. So when you see think Netflix. 75% bioavailability, 5 hours, 5-hour half-life in serum, 8-hour half-life in intracellularly and low CSF penetration, diarrhea, and flatulence. So for this one, this guy's watched so much Netflix, just eating junk, sitting all the time, that now he has nasty diarrhea and flatulence from all the junk food he ate. He's 19 years old. I'd zoom in a little bit. This is getting kind of hard to see. Whoa, that was not supposed to happen. He's 19 years old, and this is okay with pregnancy, and I didn't read that until I was all done, so I was like, oh, he has kind of this big, fat, pregnant belly, so it's okay at pregnancy because the big belly. And 3A4 and 2C19. That's why I put the 19 there, because of 2C19. And substrate and inhibitor. Yep. Okay, so here's the 3, his eyebrows. And this guy is not ever going to be a pro basketball player because he's watching too many Netflix. But he does like to watch pro basketball on his Netflix. So remember that it's a protease inhibitor. All right, next. This one's kind of gross. Sorry. Lopping. When I saw Lopping, I was trying to think of what that could do with. I should have used like lollipops or something. I'm sorry. But first thing that I chose was lopping somebody's head off. So here's a guillotine, lopping somebody's head off. That's disgusting. I apologize. And yeah, diarrhea, hepatotoxicity, pancreatitis, PR and QT, prolongation. So somebody's head getting lopped off, lopping. Diarrhea, squirting out. Here's their pancreas, fell out on the ground. That's disgusting. This is really nasty. Big 3 in their eyebrows. Remember the 3A4 inhibitor. Should have put down that it contains ethanol. I should have put like a bottle of beer here or something. Didn't do that. Somehow I skipped over that. Apologize. QT interval. Look, they got makeup and stuff on, so they're a real cutie, right? QT interval prolongations. Remember, they're a cutie, even though they are getting their head cut off and they have diarrhea. And the pancreas fell out, and alcohol and all that good stuff. Whoa. Okay, next. Next, we're going to deal with this Prenavir. Fossil. Here's a fossil. That's not an Oreo cookie. That's supposed to be a fossil. Okay. But the deal with this fossil is that it's depressed, and it has a skin rash. And these are its legs that look like a 3. And remember CYP3A4, it's depressed because it realizes that because it's a fossil, it will never be a pro basketball player. And so it goes and lives with its friends, the anemones, who drift among the underwater sulfur volcanoes. So the anemone stands for anemia, hemolytic anemia, and the sulfur volcano stands for sulfonamide. Sulfur volcano, sulfonamide fossil. Okay, Atazanavir. So Ataz, there's my Ataz. Well, that's weird looking. 65% bioavailability, 7-hour half-life in serum, 11-hour half-life in intracellularly, and hyperbilirubinemia, QT prolongation. Moderate CYP3A4 and UDP glucuronyl transferase inhibitor. So here is Ataz. Stands for Atazanavir. Ataz. Here he is. Ataz. Prolonged QT interval. QT. So I had to put some makeup on Taz. There it is. I don't know how the heck I just put UDP on the tongue because I didn't know how to fit this in here. That stands for UDP glucuronyl. And the 3 has got the 3 on the eyebrows for 3A4. And the Ataz has got his A game on because he's playing pro basketball. Next, Tipranavir. So I thought of tipping a waiter because that kind of sounded like tip. So Tipranavir. Don't know that. Only 5-hour half-life, low in there. What does it cause, though? Oh, my goodness. It causes intracranial hemorrhage. So this waiter, in tip for Tipranavir, this waiter is getting a intracranial bleed because their tip was so big, which they really needed because they were depressed. That's why they have this really creepy-looking frown. I just put the smile upside down. And they have a giant 3 eyebrow, yellow eyes for the hepatitis, for hepatotoxicity, and
CYP3A4, yep, for the eyebrow. And also this is a sulfonamide, so I try to think, okay, sometimes farts smell like sulfur, so she's farting really bad, and that's the sulfur fart is sulfonamide. Next over here, Darunavir. I couldn't think of anything that sounded even close to anything at all except for maybe Daracula. So over here, I guess I should say first 37% bioavailability, 15-hour half-life, low CNS percentage, rash and hepatotoxicity. So here is Daracula for Darunavir. So Dracula didn't know before he became a vampire he actually used to be a pro basketball player. He thinks about that all the time, and it makes him P. And that stands for, this is a P-glycoprotein inhibitor. Okay, P for P-glycoprotein inhibitor, not CYP inhibitor. Big distinction there. Yellow eyes for hepatotoxicity, rash for rash, and sulfur fart for sulfonamide. And that covers everything for that lecture.